Okay, okay, bye-bye. And I'm able to share. Okay. Okay, bye-bye. Hello. So good afternoon, good night for me, as I'm in Lisbon. And probably it's good morning for some of you, good night and good afternoon to all. I am so sorry for this, for being late, 15 minutes, but we had some technical issues, and hopefully you can see me and hear me in perfect conditions. So thank you for being here. On behalf of the Research Committee of NANDA International, I would like to thank you your presence, because this is a series of webinars that the Research Committee has organized in order to inform all those that are committed and interested in NANDA about the research methods and the level of evidence, so we can help you in developing the research and studies to increase the level of evidence of nursing diagnosis. I will share here, it is. So today we had some, okay. Probably you can see my slides, and I will start to talk to you with all these slides because I think it's easier for you to follow my my speech. So the theme today is an overview of level of evidence and research methods, and as I told you before, this is the first of a free online research series that you can find in the website of NANDA. We have 4 webinars planned. So this is the first one, the second in February, the third in April, and the fourth in June. Please find more information in the website of NANDA International. So for today, we will talk about 2 main topics. The first is an overview of NANDA International level of evidence criteria as defined in the last edition of the book of NANDA. And the second part is matching the research methods to each level of evidence. What I want to discuss with you, and unfortunately we can't talk, but is how research, how different types of studies can fulfill the different goals that we may want to fulfill doing such study or such research according to each nursing diagnosis. And this is very interesting because having the right and the best research method could be the best way of increasing the level of evidence. As you know, NANDA, the taxonomy of NANDA is research-driven and research-based. So we really need to increase and improve the research on nursing diagnosis to improve the overall taxonomy. So the goals for this 45 minutes webinar is to explore the NANDA level of evidence, as you can find in the book, and to discuss specific research methods to develop nursing diagnosis. So let's start with an overview of the level of evidence of the criteria as defined in the chapter 4 of the book. But before that, it's important to recall that NANDA as now 50 years old, so there's too many history, there's an heritage that we need to remember. And in fact, across all these years, different researchers propose different methods to research and to improve nursing diagnosis. And it's easy to find that in literature. So from the 80s of the last century, you can find in literature different methods to validate nursing diagnosis. And the term validate is very important for us today, because it's to see if the nursing diagnosis correspond effectively to the human response that nurses assess. And this is really important when we think on research methods. And you can find that in literature, you can find that in different databases. If you search for nursing diagnosis, validation, methods to validate nursing diagnosis, wherever, you will find different results, whether are research methods or discussion papers on the need to move forward, on the need to discuss other methodologies, or on the need to turn around and do different things. And this is quite interesting when we look at the literature concerning validation of nursing diagnosis. And you can find perspectives, discussion papers. So nurses that were committed to the development of nursing diagnosis were also committed to publish about that. And in fact, we can see that there are methods that have been used in other disciplines different from nursing, like social sciences, like philosophy, that are used in nursing and are being adapted to study nursing diagnosis, depending on the nursing diagnosis, depending on the population, and sometimes depending on the health condition patients are living. And this is quite interesting because it opens new doors and opportunities for us nurses to look after different methods to do and to proceed with our research. And as an example, you have, for example, the Q methodology and the RASH model that has been used more frequently in the last, I would say, 5 years. But what for? Why do we need to research, and why do we need to think on the level of evidence? Because as nurses, and whether we use or not NANDA, we do make decisions, and we need to inform those decisions based on the best available evidence. So it's good that we could count on good research, in research that has been conducted with rigor and has a good quality, because this is very important to nurses to take decision, to the clinical decision-making process. And so the last edition of the book of NANDA has a very important chapter. It's the famous chapter 4, where you can find the revised level of evidence criteria for diagnosis submission. If you want to do this activity, you can look to the previous taxonomies and look at the level of evidence on each diagnosis. And it's interesting to see that the level of evidence main are in the level 2, 2.1, and what is the meaning of that. And it's very interesting to realize that in the last book, NANDA and the research committee, and particularly these persons like Marcos Oliveira Lopes, Professor Viviane Silva, and Professor Dina Cruz, they work together. They are really experts on this topic. And they propose a new hierarchy or model for us to consider the level of evidence, which is quite interesting. And I will share with you one by one individually, so we can see the main goal is not to review the level of evidence, because you have that in the book, but the main goal is to see, okay, if I want to do a study in this level of evidence, which research methods can I use to better respond to that? That's the main discussion in this webinar. And we cannot move from the discussion on what is evidence-based practice when we talk about the level of evidence. And in fact, evidence-based practice has been defined by different researchers, and we know there's a 3-dimension related to the concept of what is evidence-based practice. And we have the client characteristics, the best available research evidence, but also the resources and the experience and the expertise of the healthcare professionals in that clinical context. And this is very interesting, because when we talk about evidence-based practice, it's not only about the research. It is not only about the research. And this makes all the difference, because we need to think also in implementing. And when we think in implementing, we are thinking in client characteristics and the clinical context. And in fact, the level of evidence tries to represent in a pyramid, in a hierarchy. And we know that the most important level of evidence are the systematic reviews, that are secondary research or knowledge synthesis. But we don't have studies like that for all nursing diagnoses. Sometimes we need to come from or start from the bottom to get the top. And this is very interesting to get this image when we do research on nursing diagnosis. And another topic I want to highlight is that when we talk about the level of evidence, we are not discussing the quality of the studies. these are two different dimensions when we talk about research. It's about the type of study that is connected to the level of evidence, and the other dimension is the quality appraisal, the quality of the study. And these are quite different dimensions. Both need to be taken into account, but these are two different dimensions, but equally important when we discuss nursing research, particularly when we talk about nursing diagnosis research. So the chapter 4 that you can find in the book is related to this table, and we will go through all these levels. When we look at literature, we have different methods. We have Fairing. It's interesting to see how these models were very important for 20 or 30 years in nursing diagnosis validation. We have different studies on clinical validation. We have differential validation. We have concept analysis. We have the publication on RASH model. We have studies on epidemiological, using epidemiologic research, whether it's predictive, case control, cohort studies, prevalence or related factors, systematic review and meta-analysis of etiological factors. And why did I show you that? It's because nothing is new. No one is doing anything new. You can find this. I think that the chapter 4 and all this framework is very important because it's well organized and may help us in understanding all the process of the nursing diagnosis development. That's one advantage of this model. To start, we need to figure what is validity of a nursing diagnosis that is defined as the degree to which evidence and theory support that the diagnosis is the appropriate interpretation for a given clinical use of a given set of manifestations. So this is quite interesting because it's about interpretation, the clinical use, and the set of manifestations. When we look at the table, you can find the different level of evidence starting in 1.1, 2, 2, 3, 10. So there's a continuous in this all these levels, and we will go all for on all of this level of evidence. So different criteria related to different types of studies. And you won't find that so easily in the chapter. That's why we need these webinars also to help you and to clarify as research committee and help you in research on nursing diagnosis. So we have 3 main dimensions, I would say. There is the first related to concept generation, the second related to theory or theoretical generation, and the third related to clinical, I would say, validation. I will use this name for now. So you can see first we need to name it, then we need to know what it is and fulfill with meaning and knowledge, and third, need to check if that's real in the clinical context. And this is very interesting. First, saying what it is. Second, knowing what it is and what is the meaning of that. And third, let's check in the clinical all the dynamics of that nursing diagnosis. And this is the 3, I would say, the 3 stages that compose this framework of the level of evidence. So let's check for each level of evidence the types of study that we can do. And I will be provocative. I will be, I think, open new doors for research, not different studies, because I'm not saying anything new, but matching studies that could help us in this 3 stages process. So when we look at the first concept generation, we have these 3 levels. So label only, label and definition, and diagnostic components and relationship with outcomes and interventions. So here we are in a level of concepts, naming things, and we can do this as a sequence or concurrently. This is quite interesting because sometimes we have the third and are naming still the nursing diagnosis. This is not an order. As you see in the book, you can do it in a sequence or you can do it at the same time. So the level 1 is a proposal that you may send to Professor Camila Takao, that is the director of the Diagnosis Development Committee. And you can say, okay, I think this is a nursing diagnosis and I have a label for that. So what is the concept you are talking about? What is the human response and the access to compose those labels? And please be aware that the new book will bring a new structure for the access, and you should be aware of that. Is there a nursing diagnosis? We should ask ourselves, is there a nursing diagnosis? Is that a judgment that nurses are doing when assessing a human response? Is that a nursing diagnosis? Is a nurse able to respond to that nursing diagnosis independently? And this is the critical point. Is a nurse able to respond to that nursing diagnosis independently? If you have the answer to these questions, I think you can do a literature review on that label that you think it's a nursing diagnosis, or a systematic review, or sometimes you have such an interesting experience in a clinical context, and you can think about the autoethnography because you lived the experience. You were there as nurse. You know that human response. You don't have a study. You didn't do a literature review. You didn't do any other type of study. But please look at this type of study, autoethnography, that is using it. It's composed of specific procedures. But it's interesting for experienced nurses, expert nurses, to propose human responses that are not in the taxonomy. And this is quite interesting to consider. If we look at the second, you should have the label and definition. As you can see, these are really, it's kind of, it's not an incomplete nursing diagnosis, but is a way of starting to compose a nursing diagnosis. When we think in the 1.2, the questions are, what are the attributes of the concept? What is the definition? So in the 1.1, you just need to have the name. Here, you need to have a definition, and the attributes of a concept gives you the definition, because the attributes are the components that says to you that human response is that one and no other one. It's specifically that one. So defining your nursing diagnosis, it's very important at this stage. And this is different from the defining characteristics. When you think on the attributes, you're talking about the dimensions on the definition. When you talk about or think about the defining characteristics, you are talking about the signs, symptoms, the way that nursing diagnosis expresses. That's different. And it's very interesting because when we, in a research point of view, it's really different when you analyze the literature to get the attributes and the definition. And the literature review could be a really interesting research method for this, a systematic literature review or autoethnography. And I would say the concept analysis would be very interesting also for this. And you can use different concept analysis methodologies, because they are in the literature. All are really good, depending on your perspective and theoretical perspective of as researchers. The 1.3, we have now what are the consequences of the concept, the antecedents of the concept, the related health conditions, the populations. Here you can see you are completing the structure of the nursing diagnosis, and that is why I would say you could have here, more than the literature review, the concept analysis, a Delphi study, or a focus group. And this is very interesting, because here you can start listening to experts to help you in analyzing what's there in the literature, what is the structure, if it makes sense, if it is applicable, if it relates to a nursing diagnosis, if it is really interesting for a nurse to address. So these are the different research methods that you can use when you think in a nursing diagnosis in this stage of development. Let's move on to the second stage of the whole framework, and we have the conceptual validity. And the conceptual validity, you have two main blocks, 2.1 and 2.2, and let's check what is the meaning of each one. So the 2.1 is related to a conceptual framework or substantive theory that should support interpretations obtained from the elements of the nursing diagnosis. What is the meaning of this sentence? When we look at the 2.1, the questions as researchers are: what is the theoretical background of this nursing diagnosis? What is the scope of this nursing diagnosis? We know already from the stage 1, what is the label, what is the definition, what are the defining characteristics, the consequence, the related factors, the populations. We know all the structure. Now we need to fulfill with knowledge and theoretical perspective. That is why we need to ask these questions. What is the theoretical background on that nursing diagnosis? What is the scope of the nursing diagnosis? Which class, domain? We need to look at the structure of the NANDA and try to find the room for that nursing diagnosis in a theoretical point of view. What is the specificity and uniqueness of the nursing diagnosis across the taxonomy? Is there a room, 2 rooms, 3 rooms? So it makes no sense. We need to find one class, one domain, and try to justify, based on the theory, that nursing diagnosis in that domain, in that class. And this is very interesting. We need to do this. We need to, because probably in this level 2, we have nursing knowledge in its best. Because here we need to say, this is nursing theory, this is what we know about human responses. It's not just the structure, where we are saying the theoretical part of that. And this is really challenging, but really neat at this time for NANDA, and I would say for nursing internationally. So for this, we need to think, or it's good to think in literature review, systematic review, concept development as well, Delphi, and focus group. Then we need to go further and ask which causes are related to that nursing diagnosis. It's not just about the previous questions. Now we are concerned about the causes, the populations, and the healthcare conditions. You see, we are composing the nursing diagnosis with different elements in a theoretical perspective, because we know that some human responses are different from in different populations, in different health conditions. And this is quite interesting, because this could influence, and probably influence, the nursing intervention and probably the nursing outcomes. So it's difficult to think on this out of the scope of the theoretical perspective and completeness of the nursing diagnosis. At this time, we could think on creating, constructing theory, creating knowledge. And this is very interesting because the grounded theory is probably one of the methods that are very helpful on that. And doing a grounded theory, we can understand how those patients in particular, how that population in particular live, and how is the process of living with that nursing diagnosis. And doing this, we will understand better the nursing diagnosis. When we go to number 3, we have this main question. In what extent do health records represent or correspond to the elements of nursing diagnosis? And this is very interesting because we are moving to clinical data, I would say. We are moving to what nurses often record about the nursing diagnosis that should be considered when designing or developing the nursing diagnosis. By doing this, we can think on developing nursing studies or research on analytic studies of health records. And it's important for me to share with you that there are several studies from different countries around the world on that analytical perspective and point of view of nursing records, trying to analyze nursing diagnosis and find more details on the different elements of nursing diagnosis. But mind this, records may not represent validity. Records represent what nurses record and register, not the completeness of the nursing diagnosis or the human response. And this is quite interesting and very important to be aware of when we do this type of research. It's very important, of course, but there's a big limitation when interpreting the results. Moving to the second block within the level 2, we now are in the domain, and the concern is how representative the diagnostic components are, and we are more focused on the content domain of the nursing diagnosis. What is the meaning of this? When we move to the 2-2-1, the question as researchers is, what is the expert's beginner's evaluation of the structure of the nursing diagnosis? It's interesting because the second block within this conceptual validity is not all looking to the theoretical part, but now beginning to look at the expertise, at the experts of those that have the experience and the knowledge to help us in fulfill and complete the nursing diagnosis. So starting by the beginners, experts, is there anything they can say about the nursing diagnosis to help us on developing the nursing diagnosis? And we know when we talk about experts and opinions and perspectives and getting consensus, we are talking about Delphi and focus group. And this is a descriptive analysis. We have here just descriptive. We don't want to analyze this. It's just in the topic, in the dimension or the quality of describing what the expert beginners would say for that nursing diagnosis. When I move to the second, the question is, what is the expert beginners or advanced evaluation of the structure of the nursing diagnosis? And here I have a Delphi and a focus group But as the experts are not anymore beginners, they are advanced, I could think in analytical analysis and go further and deeper in the analysis and the data that I get from the Delphi or focus group. When I'm moving to third and fourth, the different are in the samples. You can see here small samples and large samples. The question is the same. What is the expert proficient or advanced evaluation of the structure of the nursing diagnosis? And we have in 3 small samples and large samples for the in the 4. And of course, the research methods in use to get this level of evidence are again Delphi and focus group, and again analytical analysis. So in the first we have a descriptive analysis, and then according to the level of the expertise of the participants in the studies, we can think in analytical analysis. So as you can see, this group 2 is related to getting the expert's opinion on that nursing diagnosis. Moving into the 3, and I want to be on time, in the clinical validity, as I told you before, the first is naming, the second is creating theoretical perspective and looking after the expert's opinion to get a nursing diagnosis that is has a name, has a definition, correspond to the human responses, is used in clinical practice. You can find in the records, and the experts could say, okay, this is a nursing diagnosis. No, in the third stage of all this framework of the level of evidence, we can move into the clinical practice or clinical context and see if, in fact, are another elements or validate that proposal in the clinical context. So the levels of evidence correspond to the type of clinical inference to be obtained from its clinical components. So here we are moving into the clinical, and this is the most, I would say, I won't say the most important, because all the 3 are very interesting and important, because when you name for the first time a nursing diagnosis, it's also probably the most important part of it, not the clinical. But this is very challenging, because it's like live research, you know, because you look at nursing diagnosis, you study the nursing diagnosis, the dynamic of the nursing diagnosis, the composition of the nursing diagnosis in clinical context. It's like live research. This is very interesting, and we could think on this in different levels, as you can see here, block 1, block 2, and block 3. So in block 1, in which population may a diagnosis be applicable in practice? Sometimes you have a diagnosis that you didn't create, it's there in the taxonomy, and you need to check if it's only for children, adolescents, or you can think for elderly, for example. So you need to check that, and you need to check if there are other populations that we can think for that nursing diagnosis, and we need to do that in the clinical context. So when you think in this, you think in this block 1. In block 2, what is the utility of defining characteristics for different clinical purpose? Now you are thinking on clinical validity, selective, discriminant, prognostic, and generalizable validity. And we will see what is the meaning of this. And in block 3, which factors contribute to the occurrence of the nursing diagnosis? This is a more robust question, because you are searching for the factors that makes that happen. This is really important, and we need more research on this. So in the block 1, I would say, sorry, that we are looking in the clinical context, is this nursing diagnosis representing patients' experiences? And this is, I smile, because this is the qualitative part of the nursing diagnosis validation. It's not too much frequent to find research on nursing diagnosis in a qualitative point of view. But think, if a nursing diagnosis is a human response, probably this is a very interesting method and strategy to get human responses from the patient's or the population's voice. So the qualitative research, it's very important to refine the nursing diagnosis. And it's here in this framework. And thank God it's here, because we do need the qualitative research to clarify, to get a deeper insight on patients and populations' perspective or voice on living that human response. So here we have the qualitative research, and we can do it phenomenology. We can use phenomenology if you want to understand the living experience of that. You can do ethnography if you want to go in the culture and observe. It's a participatory observation, and look at that human response and that nursing diagnosis, or grounded theory if you want to understand the process of living that nursing diagnosis, or case study. This is different qualitative studies that you can use here for this level of evidence. When we think in demographic validity, you ask for in which populations may a diagnosis be applicable in practice. And for this, you can think on cross-sectional studies to study the association between participants' characteristics and the elements of the nursing diagnosis. Here, you have cross-sectional research, observational studies that could find the relationship between the characteristics of the participants and the elements of the nursing diagnosis. And sometimes this research results in specific new nursing diagnosis, which is quite interesting. For example, for children, for adolescents, for a different period of, for example, acute disease, chronic disease, end-of-life condition. And we need to do this. We need to increase and improve the research doing this, understanding better the relationship between the characteristics of the people and the nursing diagnosis and human responses on that. The block 2 is related to these questions. The first on the block 2 is, what is the specificity and predictive values of the defining characteristics? And I think these were the most frequent studies that have been done in the last years using Fairing model, looking at the predictive, specific, and sensitive defining characteristics of each nursing diagnosis. This is very interesting and very useful, because some nursing diagnoses don't have many studies, and we need to, it's a good starting point for those nursing diagnoses. So these are epidemiologic studies, methodologic studies that includes the sensitivity, specificity, and predictive values of the defining characteristics for that nursing diagnosis. But if we have these questions, what defining characteristics are valid to get an accurate nursing diagnosis? Then we are talking about selective validity. And for this, we have, again, epidemiologic studies that includes also the sensitivity, specificity, and predictive values. But we should be aware that we may need large samples to get all the statistics done with rigor and with transparency. Moving forward, we can have also this question: what defining characteristics are valid to differentiate similar nursing diagnoses? And this is quite interesting, because when we look at the taxonomy of NANDA, some nursing diagnoses seem very similar. And we need to think that different nursing diagnoses should be represented by different defining characteristics, different risk factors, different elements. Otherwise, it's not helpful for nurses' clinical reasoning. And this type of research we can do by discriminant validation studies or differential studies. It's not frequent, the differential studies, but I think it's a really good priority to improve the transparency of the taxonomy of NANDA International. When we move to the question, what defining characteristics are valid and anticipate patients' deterioration in that clinical context, this is further, we are thinking now in studies that are telling me something that is related to the risk, to the probability of the occurrence of that nursing diagnosis. So I'm thinking in longitudinal studies and cohort studies. These are, we know the principles of the research. These studies are more, they need more time to be done. They need more resources to be done, but they need really to be done. We do need to do more research in a longitudinal perspective to understand the profile of the nursing diagnosis and to understand where are the key points for risk or the key points for the prevalence, high prevalence of some nursing diagnosis. And then we get the generalizable validity of defining characteristics. And going by this question, what is that set of defining characteristics valid to an accurate diagnosis in different populations? In fact, when we look at the taxonomy of NANDA, some nursing diagnoses have so many defining characteristics that it's difficult for nurses to see 3, 4, or 5 that are more specific, predictive, and sensitive to that nursing diagnosis. And we need to create this set of defining characteristics that help nurses to say or to diagnose in a more accurate way that nursing diagnosis. So this could be done by secondary studies or synthesis of evidence. We are now almost in the top of the level of evidence with a literature review, meta-synthesis or meta-analysis, meta-synthesis for qualitative, meta-analysis for quantitative studies. And we are here in the top of the level of evidence. This is quite interesting. Moving into the block 3, and I'm almost done because I'm on time. I can ask which causal relationships between multiple factors in nursing diagnosis. We are moving even further because we are asking about the reasons. We are asking about the factors that causes the nursing diagnosis. And this is very in a preventive way of being in healthcare, is trying to anticipate decisions. And it's very interesting to think on research to fulfill this goal in nursing diagnosis. So it's a case control study that can do this. As you can see, so many different research and different types of studies can help us in increasing and improving NANDA International. When we think which causal relationships between an etiological factors and the group of nursing diagnosis, I'm not thinking individually, but I'm thinking the causes for a set of nursing diagnoses. And this is a more complex perspective on nursing diagnosis, but we need to do that. And some nursing diagnoses in specific populations really come out as a group. And we can do this research in that perspective. So it's exposure cohort studies. So we need to see who has that nursing diagnosis and follow to understand that group of nursing diagnosis. How is the profile of that nursing diagnosis? At the end, and we are in the 2-3-10, does this set of etiologic factors causes those nursing diagnoses in different populations and settings? Here it's a more complex perspective and questions. We are asking if that causes of that specific nursing diagnosis are different for different settings and populations. It's not thinking, is there different diagnoses? It's more complex than that. Is trying to understand if that nursing diagnosis, not nursing diagnosis, the causes of that nursing diagnosis also differs in different population and in different contexts. And this is a more complex perspective on research, but very useful for us for clinical nursing decision-making and for planning interventions. So we can do systematic review of related risk factors, and we have guidance for that. The Joanna Briggs Institute, for example, has guidance, a specific guidance for this kind of systematic reviews, and I think this could be very helpful for those who are interested in this kind of research. So we've been looking after all this framework, all this model, and I try to give you different perspectives or different studies that could be considered in each of the level of evidence. So at this time, I will open for discussion because it's very important for discussion. I think we can have 10 minutes, but first I want to invite you all that are doing research on nursing diagnosis to apply to fill the registry of the NANDA research, because you can be here with us. It's very important. You can go there and you can find researchers, you can find where it's being conducted, and we can create more network, because NANDA is an international organization, and I think it's very important for us to be connected in this topic that is common to all of us. So please do that. If you are doing research, fill the form and be here in our map and collaborate with us to increase the value also of nursing diagnosis. So I'm more than happy to discuss with you, and I want to let you hear this information, to share this information of the second webinar in February. Don't miss that, because it's with Marcos Lopez and Viviane Silva, and they are talking on research on concept generation and theoretical support. So this I will unshare. This was the beginning of the webinar. So I talked to you about all the level of evidence, and in the next webinar, Marcos and Viviane will talk to you about specifically that topic. So thank you all for being here, and I'm more than happy to answer some questions if I'm able to read it. Okay, I'm not sure.
Sylvia, we just want to make sure that they put the questions in the Q&A section as opposed to in the chat.
Okay. And where can I find that, Heather? I have one hand raised.
It should be at the bottom of your screen, kind of right in the middle beside the record button, Q&A.
Okay, I find it. No questions yet. Okay, find it. So you can write in Q&A and I can answer. I can read and answer if you want to. I have Fatima here with raising her hand. So can you write your question, please? I had no questions. Heather, can you see any question, please?
Right.
No.
I don't see anything, but I'm trying to let her speak. So,
okay.
Fatima, I think you should be able to. if you unmute yourself.
Fatima, do you have any question? Fatima, yes. No. I don't think so.
So I
So
don't
have
see any questions.
no. Okay. Is there any question? I'm happy to answer and to discuss. Are you able to write in the Q&A? No? Okay. So as I don't have any question, unfortunately, I would I would like to discuss with you all, but I don't have any questions. I don't understand if you are not able to write or you don't have any questions. So thank you. Oh, okay, one here. Okay, Fatima, I just want to thank you. Thank you. Thank you. Thank you for being here. It's a pleasure for me. It's and on behalf of the research committee, I'm here on behalf of the research committee, and we are happy to share this with you all and to collaborate and to be here. If you have any question, just email. And I want also to thank you all that submitted and applied for being with us in the research committee. And it's an honor for us to serve NANDA and to be with you and to share this knowledge because the most important thing is developing nursing diagnosis and being together on that work. Okay, so Fatma is from Morocco. So thank you very much. I think we can close this webinar because we are 60 minutes on time. So it was planned to be 60 minutes. So we were like 10 minutes. And again, I would say that I'm happy to answer your questions as the research committee director. Please feel free to send your questions and don't forget to be in the next webinars. Thank you very much for being here and be happy. Bye.